Hi, I'm Gloria Maggio with the Pitt Community College English as a Second Language program. Joining us today is Steve Davis, who is from the Outreach program at Bernstein Center. Welcome.
Thank you. Thanks for having me.
Glad to have you here. Now, what kind of services are offered at the Bernstein Center?
Well, we have a variety of different services. We offer medical services. We also offer dental services. We also have a mental health program as well. And one of the things that I do is I work with the Outreach program.
Okay, well, while you mention it, what is the Outreach program?
Well, the Outreach program incorporates a lot of different parts. What we do is we go out to the field, out to where the people live, out to where they work, and we provide health services. Those
Such
services, well, they could include case management. We do a lot of health education. We do a lot of delivering medications. We interpret. We'll transport people that don't have transportation to come to the facility. But something else that we do that's really neat is we take mid-level providers out to the camps and actually do health care on site right where the people live.
Mid-level being
a mid-level being a physician assistant, a nurse practitioner, yes.
Okay. Now, I know you have a sliding scale for payment, so you can take people with or without insurance.
Yes, we are a community health center, so we take anybody that lives in the community, whether you have insurance, whether you don't have insurance. If you do not have insurance, the way it works is you pretty much bring in the income that people make in that household, and then depends on how many people live there, and that'll let us know where you fall in the sliding fee scale. It could vary. We have different levels that you can qualify depending on what your salary per person in the household.
Okay. Now, if I'm from another country and I need some help with the language and understanding the doctor or the dentist or even the therapist, I know you have Spanish interpreters, but what about all the other languages that are served in this area?
Well, like you said, Spanish, if you speak Spanish, pretty much we should be able to have that covered no matter what clinic you go to, whether it's dental or medical facilities. We have seen a increase of other languages, especially over the past 5 or 6 years. This year we had some patients that were from Haiti that spoke Creole. We've had people that speak different Oriental languages. And speaking of Hispanic or Latinos, we actually have farm workers that speak indigenous languages and don't even speak Spanish.
So how do you help those people?
How do we help those people?
Yes.
The best way we can. No, a lot of times, as far as we've had Hmong, a lot of times we don't really have people on staff right now at Greene County Healthcare that speak many other languages that we're seeing. Now, we do have some providers that speak French, that speak Arabic, but unfortunately we don't see a lot of those languages. So we'll either have to use a language line or try to reach out in the community and find somebody that speaks those languages, which we have done in some of our other facilities.
So it might be best the first time you come into your clinic or one of your clinics to bring somebody with you who speaks your language, just the first time.
Oh
probably.
yeah, without a doubt. Especially if it's not Spanish, if it's another language besides Spanish or English, we'd recommend to bring somebody that can help you.
Now, do you have any type of emergency services too, or is it just planned
It's mainly
appointments?
Appointments. We do have providers that are on call, but that's more of non-emergency type of situations.
So for an emergency, you just call 911.
911, yes.
Okay. Now let's say I've decided I have a cavity that needs to be filled, or I have a condition medically, and I want to come to. You have 2 locations.
Yes, we have facilities in Greene County and in Pitt County.
Okay.
Yes.
What's the first thing that I need to do?
Pretty much just pick up the phone and give us a call, and just pretty much tell us what's going on. And, if it's something that you can wait for, if it's a non-emergency or not, I'm not going to say emergency, if you're not in any type of pain at the moment, or if you're calling the medical side, if you're not sick, then we can set you up an appointment and get you in. And when you come in, we'll help get everything set up to see where you fall as far as qualifying for payment if you don't have any type of insurance.
Do you discourage walk-in clientele?
We don't necessarily discourage them, but unfortunately, because we have grown so much, our patient population has really grown. We're seeing a lot more people than we've seen in the past. So if you do come in as a walk-in, there's a good chance that you're going to have to wait a while, or you may be asked to come back maybe the next day when there is an appointment if it's something that's not really urgent at the moment.
And what if somebody wants to use the outreach services? Is it the same thing that they call you and make an appointment?
Yeah, pretty much. They can call the outreach office. And we work in about 10 different counties. And also, I said earlier, we have 2 sites. We actually have a site in Pamlico now, another clinic is in Pamlico. So we actually have 3 sites. We have a lot of different sites, but we have locations located in Pamlico County and Pitt County and Greene County as far as the clinics go.
And the outreach, it doesn't necessarily have to be someone that's confined to a wheelchair or is not ambulatory or can't move around.
No.
Right?
The outreach program, we concentrate working with farm workers and a lot of migrant farm workers. And a lot of those workers are brought here, they're dropped off, so they're kind of at the mercy of a grower or a crew leader. And during the main part of the season, when there's 1 or 2 crew leaders that has a crew of 200 people, it's almost impossible for them to be able to get people to and from the doctor, get their medicine. So a lot of times that's when outreach will kind of step in and help with transportation. Or if we go to a camp, there's 4 or 5 guys, for example, complaining of sore throats or earache, then that lets us know that's probably a good camp to take a provider to. So, and we do that at night. We do that when they're not working, and those services are free. There's no charge for that. So that way we're kind of trying to keep the people healthy, but not necessarily they're having to miss work.
Now, how many people would you say you serve within the counties that you serve?
I think if I'm not mistaken, we served around 30,000 people last year. I hadn't got a number for this year.
That's impressive.
But yes, it's a large number.
It's a lot of people.
Yeah. And that includes outreach and people actually coming into the clinic.
I want to be clear about something, that even though you do have reduced payments and sliding scale and take people without insurance or with insurance, it doesn't mean the doctors or dentists or nurse practitioners, what have you, are any less qualified than any private practice. Is that correct?
That is definitely correct. I have insurance, but I still choose to be a patient at Greene County Healthcare because I do know the quality of service across the board. When you're talking about dental, my dentist is here at Greene County Healthcare. It's not because I get a special discount. My medical providers here at Greene County Healthcare, and I've actually had services from our family therapist here as well. Just because we're a migrant community health center and offer maybe what you consider a discount, doesn't mean you're getting any less quality of care than you would at private practices.
And that's a high recommendation coming from someone who works there that would actually go and use the services there too. So.
Yeah, and like I said, I don't get any really type of discount. I chose because I know that we have good providers here.
Thank you, Steve Davis, for being with us today. And I'm Gloria Maggio for Pitt Community College English as a Second Language program.